That's right. My friend Lucky says one day the charcoal seller's son will wear a white shirt. Yeah, we're shining in the studios here. Dr. Michael McCarthy, consultant obstetrician gynecologist with the Sinal Specialist Hospital, Tema, joins me for another blockbuster extended version of Ultimate Health, a 2-hour version. Yes. Tell the person next to you, share it with them. We're going till 4 because my senior brother Bile has other duties, so there'll be no Sunday rhythms, but that gets us an extra hour. Today we're doing a full focus on fibroids. Full focus, the full 360. What is a fibroid? What causes the fibroids? What kind of symptoms should alert you to the fact that you may have fibroids? How is it diagnosed? And indeed, how is it managed? And we'll get into all that. Treatments, managements. Can you shrink fibroids? Did you do anything to cause them? Should you be drinking any concoctions, herbal or whatever? And then the major surgical interventions as well. Big words in there. At the tail end, you might even hear something called hysterectomy. We might get to do all that and a bit more with Dr. Michael McCarthy of the Sinal Specialist Hospital. And those of you who don't tune in early, come on. Let's start together so that we keep the questions in the flow. But we don't mind pulling it back when you ask us to. This is Ultimate Health on Joy 99.7 FM, Palm Sunday edition. Full 360 focus on fibroids. If you have any questions, concerns, experiences, fears. Yes, a couple of years ago, I had a woman who was just so afraid of having this seen to. I remember referring her to Dr. Resolve, Paddy Ayete at Resolve. Didn't see her again after that referral. A couple of years later, she drove past, or should I say, she came to my office. I said, you might not remember me, but I came here a couple of years back and you convinced me to have this done. And this lovely young lady, little daughter next to me in the school uniform, is the fruit of that decision. So today we're talking about fibroids, the full 360 with Dr. Michael McCarthy. Doc, you're welcome.
Thank you. Happy Easter.
Yes.
Happy Palm Sunday.
Happy Palm Sunday. I sent it to somebody and the person said to me that,
What's the response?
Is it really a big deal? Do you really say that?
It is a big deal.
It is a big deal. Come on.
It is a big deal.
Triumphant entry and we're blessed.
Yes,
yeah?
We really are.
Yeah. So, what made you choose white today? White shirt just like me. Wow. There must be we must be connected somehow.
Yes, I think that the major reason was because I was coming on the radio program.
Okay.
And I knew now radio has evolved. And now they don't just see your voice, they see your physical image as well.
Someone once told me that is your guest reading? We don't like that though.
And they were watching.
We're watching online.
Online, yes.
Like, he's giving the answers, but I'm spying him. He's reading something. I don't like that.
But it's okay to refer to some data.
I know. You want to be specific and accurate because we have discerning listeners.
Oh, yes.
Yeah.
Oh, yes.
With big questions.
Yes.
Right. But it's
always
always
exciting.
Yeah, always awesome to have you, especially when we're wearing the same thing.
Yes.
Right. And maybe our dads, both our dads are, gynecologists. Well, my dad is late, passed on. Right, your dad is a big man in the field as well.
Yes.
Yeah.
Yes.
So maybe
and your mom was a nurse. My mom is also a nurse.
Yeah, my mom's a midwife. She claims to have retired. I guess now technically so. Yes. But so we're connected.
Very much.
Connected.
Very close.
All right. So charcoal sellers, sons in quotes, wearing white shirts. We're going to be talking full 360 for 2 hours about fibroids. All right. Sounds like a very familiar thing. We hear it all the time, but let's pin it down. All right. What are fibroids?
Well, and this is a very important topic.
Okay. You have a whole book on it.
Yes, I wrote a book.
Yeah.
It is more of a patient education book than a textbook on uterine fibroids to let us understand what these things really are and how we should react to them and what the men should think and so on and so forth. It's important mainly because it's something that's so common. It's the commonest tumor of the female reproductive system. The commonest pelvic tumor. And so most people have met somebody who has fibroids or have fibroids themselves or have heard of somebody. So it's so common that we need to talk about it. The second reason is that there's a lot of misconception. Because it's common, and there are a lot of things that are going on around it, and people are saying all sorts of things about fibroids and what they are and what they can do and so on. And so it's really important for us to understand the medical things behind it, and then take right decisions. And that's really, these are probably the three big points. One, very common. Two, a lot of misconceptions. And three, we need to take the right decisions when it comes to
So listen up. We're going to try and clear and clarify the issues, the real deal when it comes to fibroids. But let me hit on this part of it being very common. I was reading something which suggested that by the age of 50, almost 80% of women will have, something close to or actually a fibroid. Is it that common?
Yes, it's
as you grow older.
It's that common. It's more common in women of African origin. Wherever they are in the world. So more fibroids in Africa than the rest of the world. There we go.
So we're leading in something. Unfortunately, fibroids.
We're leading. And the fibroids increase as the women age. And that's why you said by 50, cumulative incidence of maybe 70, 80%. That's a lot. That's a lot. I tend to notice that by 30, 35, you get a large number of women having fibroids, maybe 50, 60%.
Wow.
This is less in other populations where it may be 20, 30, 40%. But in our population, it's much more. By that age. So as you're growing older, then you're more likely to either start experiencing the symptoms or developing the fibroids and not knowing and so on. But we also have people who are much younger. I've had 24-year-olds who have very large fibroids already.
What about teenagers?
Usually not. Usually not. I did a very small study on university students. They tend to be mostly 19, 20-year-olds. And I found just a few who started showing small fibroids. But they definitely start growing in the teenage years. Only that, a fibroid grows from a single cell in the uterine muscle. The uterus is really a large muscle. During menstruation, it's able to contract. Muscles contract. It's able to contract and push the blood out. During pregnancy, it's able to just enlarge and relax and enlarge, And then during labor, it's able to contract again and push the baby out. So it's a muscle. Basically. Of course, it has some connective tissue. It has blood vessels. It has a covering and all that. And these cells start to develop abnormally. One cell will just change and start developing, maybe some chromosomal change. Something's happened inside the cell, and it decides, I don't want to grow the way I'm supposed to grow. I just want to keep growing, and so it starts multiplying and becoming bigger and bigger. But it's a slow process, so it takes a number of years, and that's why you see the incidence increasing as the women age. All right. So this takes a long time. So even though it may start in the teenage years, it doesn't become apparent till a bit later, maybe early 20s. Or more commonly 30s, early 30s and mid-30s. So it's something that starts really small and then keeps just growing slowly.
So we're talking essentially about a deviation from something normal. The uterus you described as a muscle, right? It grows and it changes according to certain patterns, and its cells will do so as well. And you're talking about some abnormal growth of these cells.
So one cell will decide to just grow abnormally without control. So instead of falling in line, it decides just to grow on its own, and so it just keeps multiplying. And then becomes a big mass, as small as maybe a groundnut or a bean, and then gets bigger, You can have some as large as a small melon.
Wow.
You know, so they could be of various sizes. Some people have just a few.
Okay.
They may have just 1 or 2 fibroids.
Okay.
And there is another variant where they have a lot of fibroids, multiple fibroids, small ones all over.
Okay.
I have had more than 154 removed from one person alone. Recently,
154 abnormal growths.
yes, from one person alone.
Right.
You know, that was a few years ago. More recently, I've had one that had 99. That's one of my more recent ones. So some could be a lot.
Too close to our frequency.
Some could be a lot. Yes, 99.7 fibroids.
Okay, right. If you just joined us, it's 21 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05, we come to you with the best, top-notch, most accurate, precise, up-to-date health information. Today, we're talking about fibroids with none other than Dr. Michael McCarthy of the Sinel Specialist Hospital. He's an obstetrician gynecologist. We want to, should I say, wipe away all the misconceptions you may have about fibroids and get into what causes them, how you would be able to know in terms of symptoms, signs, risk factors, if you have a fibroid, how it's pinned down and diagnosed, and then we'll get into the management of this. Today, Ultimate Health Palm Sunday edition is going all the way to 4 o'clock, right? So we get to do due diligence, and we'll probably get into more detail. We'll surely get interactive and invite you. My WhatsApp is 0244340437, so you can send in your questions now so that Doc can deal with them directly, and then shortly we'll activate the phone lines. Remember, we're also live on Facebook and YouTube. And let me remind you also that our Easter Soup Kitchen is coming up. I'll give you a bit more detail on that, right? That's the reason for the season, and we also get in there as Joy 99.7 FM. So our Easter Soup Kitchen is coming up on the, I think, 21st, right, of April, and we want you to help us, really help us with these unfortunate children on our streets. So, Doc, coming back, so we've got this irregular growth. Yes. You can have several of them. And we're getting into what causes them. Okay, irregular growth of cell or tissue, but what would cause this to happen to anybody?
Well, the root cause is some abnormal system that is happening within the cell.
Okay.
Either from the chromosomes or from its environment.
Okay.
But more looking at the cause or the factors that are associated with it is what we can see has to do with higher levels of progesterone and estrogen.
Right.
So progesterone and estrogen are what would then drive the growth of this cell once it has changed.
These are hormones.
These are hormones. These are the normal hormones that occur in women.
Right.
Of course, men also have the same hormones, but at a much lower level.
Okay.
But these are the main hormones in women, estrogen and progesterone.
And they control some of this cell growth.
They control the cell growth of the uterus.
Okay.
And so once these abnormal cells also start growing, they are also influenced by the progesterone and the estrogen hormones that occur within the body.
So you have a woman has these normally, and they trigger or could facilitate the growth of these cells. So where you have higher levels of these hormones, then you're going to have more activity and more growth.
Exactly, and it does not
the fibroid.
It does not even need to be significantly higher levels.
Right.
It can just be the presence of those hormones.
Okay.
Being enough to stimulate the growth of these abnormal cells. Remember, the key is the change that has occurred inside the cell.
Okay.
By any situation where you have estrogen, so in a normal menstrual cycle, you have estrogen and progesterone.
Okay.
So somebody who is having cycles all the time has more estrogen and progesterone, is able to then facilitate the growth. Okay. People who start their menstruation a bit earlier, maybe instead of in their early teens, maybe they may start at 8, 9, 10. Right. Then you have a longer period of exposure to estrogen and progesterone, therefore you may be at a slightly increased risk.
I was going to ask that. So if you haven't started menstruating, are you
your risk lowest.
Less likely to have fibroids?
Yes.
So it's related to your reproductive cycle and your reproductive years.
Yes, exactly, exactly. And you notice that then after menopause, because there is not as much estrogen and progesterone, the fibroids tend to shrink or become smaller or to degenerate. You know, so that's the link of estrogen, and you realize that even during pregnancy, when there is a lot of these hormones during the pregnancy, the fibroids tend to grow at a faster rate and become much bigger. You know, so the estrogen and progesterone is very important. So
that's one culprit. Hormones.
Right. The hormones may even be hormones that we take in as maybe things that we use to treat our patients or contraceptive methods with estrogen and progesterone. They may also add to all this, but we need to remember and understand that the key is the change that is occurring on the inside of the cell. So that we don't say, oh, estrogen, so let me escape estrogen. No, it doesn't work that way. There's something already happening. And it's genetic. It is genetic. I mean, you will notice that those who are having fibroids, if they have sisters, are likely to have fibroids in the sisters as well, or their mother or their maternal aunt, and so on. There may be that trend where it is going along in the family. So you look through the family history, as we
more
call
likely.
It. You're then more likely.
More disposed to having fibroids.
Yes,
it doesn't mean that if you don't have this family history, you can't have fibroids.
We have people who, well, they tell us they don't have a family history. Maybe they don't know. But some do know that, well, my mom doesn't have, none of my sisters has, none of my aunties have. And I have fibroids, and we prove that it is fibroids. Yes, you have those ones as well. But you also have this situation where it runs in the family. You know, I even had a family where the number of sisters, a section of them were more fair-colored and a section of them were more darker. And then one of the groups was having more fibroids and the other group was not having fibroids at all. And that was quite interesting. So you could see that there were some genetic things going on within, which were also affecting the cells of the uterus. And then resulting in this.
27 minutes past, you have 2 on Joy 99.7 FM. We're talking fibroids, the full 360 with Dr. Michael McCarthy in the studio with us. If you have any questions, concerns, WhatsApp 0244 340 437. 340-437 0244. That's right. That's my WhatsApp. We're live on Facebook and YouTube, and we'll shortly also take questions and contributions on the phone lines. We're going all the way to 4 today on Ultimate Health, so stick with us. We're trying to do the full detailed discussion. This is Notte, please ask doctor for me. I heard when you take paracetamol or painkillers during menstruation to reduce the painkiller makes the blood clot and it causes fibroids.
No,
is it true?
No.
This is from Iraba. Iraba. Doctor says, hell no.
No. You see, these are some of the misconceptions that we are worried about, that clients are worried about. And so they would not want to take painkillers if they have severe pain. But I think they should take painkillers if they have severe pain. And they are not overusing the painkillers. And also, they have been to see their doctors, because not all menstrual pain, and that is just normal menstrual pain. Some menstrual pain is really different, which needs to be addressed. Some may be due to fibroids. And that could be
we'll be getting to the complications as well.
Yes. So let's not blame the painkillers. It's something deeper than just the painkillers.
Right. Hi, Notte and Dr. McCarthy. Many people don't believe in myomectomy just because they hear people saying even if you remove the fibroid, it still comes back. I really want to know, why then does it come back? And if it's true. Secondly, can a lady conceive after a myomectomy? This is from Mike in Adenta. Mike, I think you were quite instrumental last week's program as well. We'll come to that, right? He's just wondering about, the recurrence of fibroids, and then that's why people don't want to have the myomectomy. That's the removal. We'll get to that. Thanks, Mike, for sharing that in Adenta. I think I had another one. Let me just quickly try and read that before I come back. This is from Amma. She says she's 46 years old. I've had 2 surgeries on fibroids, and the last one was last year. And I had my womb removed, and I was told my menopause may start early. I've been forgetful these days and having hot flashes, but my sex life has improved. Can it be the reason Wow.
Something positive.
Right. People are forcing us to pedal very quickly forward.
We're going fast.
We're going fast.
I like this one.
People have done the fibroid course already, so they want to go ahead.
Yeah, I think this is a good one. I mean, she's told us fully the cycle that she has gone through and so on. And I think this is a testimony that it may not be as bad as is being portrayed. Fibroids will come back. Fibroids will
they come with a bad name.
Here she's saying that something significant has improved in her life.
Right.
I think that is
after obviously a medical intervention.
Yes.
Thanks for sharing that, Amma. We'll get to that in a sec. So let's just quickly come back. Right. So we've discussed hormones. Any other causes? You mentioned pregnancy as well, where there's also a spike and activity.
And then the family history.
Family history.
You see things that are happening in the family also show, and some of the medications that we take, especially the hormones we've mentioned already.
Okay.
So these are more or less the risk factors. There are also things like obesity.
Right.
Dispose you.
What's the hookup? What's the link there?
Because there's more hormone, especially estrogen.
Okay.
Because
when you're obese.
Yes, there are different types of estrogen.
Right.
There is the E1, E2, and E3. Let's just go through. It's very simple. It's just 1, 2, 3.
Okay. So you say.
And there's the E3, which can be converted to E2, and there's the E2, which does most of the work. Okay. And in obesity, you have more of the E3.
Okay.
Which can be changed in the fat. The fat tends to convert the estrogen.
Okay.
And so because you have more fat, you also have a little bit more estrogen that can predispose
of the
you.
ET variant.
There has
E3, sorry.
Exactly.
Yeah. Okay.
But there is also the issue of diet.
Okay.
One study showed that diet high in fat, red meat, which had less vegetables and fruits, caused an increased rate of growth of fibroids. Okay, so they were able to show that those who had a diet with more water, fish, and vegetables and fruit, their fibroids grew at a slower rate.
Okay, so this is,
all right.
Should I say after the fact? You've already developed the fibroid, but this diet
rate of growth. Because
accelerates the growth.
Yes, because if your fibroid is not growing, there's some tiny fibroid sitting somewhere and it doesn't grow for 20 years, you won't have a problem.
Okay.
You see, and I'll highlight that in a minute when we're talking about the symptoms. And then also the issue of exercise. Those who are more dormant and less physically active tend to have faster growing fibroids.
Okay.
And so these are ways that maybe later on we can talk about the interventions that we can have also.
Great stuff. Now to ask doctor, who are those most susceptible of having fibroids? Does the absence or failure to give birth early also encourage the growth of fibroids?
There is some link between number of children and fibroids, where those that have not given birth before tend to have a higher incidence of fibroids. But this is a correlation, not necessarily a causative factor. So we need to understand.
When some things happen together, that they are correlated, but it does not necessarily mean they cause.
One is causing the other.
Okay, great. Note, I'm almost 50. I have a son who is 10 years old. I had him after myomectomy. The fibroids are back, though. If I take out the fibroids and my womb, will my menses continue? Right. Folks are way ahead of us, but can we give a kind of a response, and then we'll come back in the flow?
This is interesting because here we have a lady who has one child,
right,
and she's now 50.
She's
now
50, so she had him at 40.
Yes.
Right.
So 50 is about the age of menopause, either just about happening or just about to happen, or maybe has already happened. And we're expecting that fibroids will start to become smaller at this time, will start to shrink. At least they will not grow. So depending on what symptoms she's experiencing, the kind of complications she's having with these fibroids, the treatment could be either to wait and allow the body to help the fibroids to shrink, and the symptoms will disappear. But if she's having significant symptoms and large mass and so on and so forth, then maybe some surgical intervention may be needed. If her symptoms are bleeding, however, then we need to rule out other things like endometrial hyperplasia, a big word, endometrial cancer, which is also very important. Not that the fibroids are causing that, but that may be something else that's happening in her. So she definitely needs to go back to her gynecologist of 10 years ago and I'm sure he will address her correctly.
Okay.
And make sure she's fine.
Right. Okay. There's let me call it a normal growth on my WhatsApp inbox, a normal growth. But if I don't address it, maybe we may have to do some kind of WhatsAppectomy, right, to take some of them out. So, Doc, with your permission, let me just try and read through a couple of these and see if we can get back on track. I'm 46 and I had my fibroids removed, and 3 years on they are back. I had a few months of the heavy cycle and now no more menses. Should I be worried? Is that it? Am I in menopause? This is a 46-year-old, had fibroids removed and myomectomy, and 3 years on she's had a recurrence of fibroids.
Yes. Average age of menopause in Ghanaian women is 48.
Okay.
And she's 46, so
right.
she's getting close to the average age of menopause.
Okay.
It's possible that
right.
she's starting to get, she's perimenopausal, that's
right.
around menopause.
Okay.
It's even possible that if she says she hasn't had her period, I don't know for how long, if it's up to a year, then that may be menopause.
All right, okay. All right, good day, doctor. During my third pregnancy, I was diagnosed with some fibroids about 6. My doctor advised that he'll take it off during surgery. Unfortunately for me, a different doctor did the surgery and didn't take them off or out. In August, I inserted an IUD into the uterine device, but afterwards, anytime I menstruate, I have severe pains in my abdomen, which I've taken to the hospital several times. Can the pains be associated with the IUD or the fibroids? Again, you guys are way, way, way ahead there, but...
yeah, we are really going ahead, but that's fine.
Right.
The pain could be due to either of them. It could be from the IUD, it could be from the fibroids.
Okay.
If she didn't have pain before August, and then after the IUD was inserted, she started having the pain, okay. I'll probably blame the uterine device first.
Okay.
And look around that and see whether that's the issue.
Right.
But if she had pain already before, and now the pain is just getting worse, then we could consider that maybe the fibroids also has a component.
Be interesting to know. At least probably she has kids, so she's using the IUD.
She said during my third pregnancy. So probably,
to control, birth control there.
Exactly.
Right.
But sometimes you can use the IUD, especially the Mirena, the progesterone containing one, which is called Mirena,
as a treatment.
As a treatment for excessive menstruation.
Yeah. Okay. Yeah. Right. So that's why I said that would be interesting. I skipped the fact that she already stated the third pregnancy. Wow. You did not answer my question. Will my menses continue if I take out my womb?
Yes. We didn't answer that question. That's right. If the surgery is to remove the whole womb, that is a total hysterectomy, then there will be no more menses.
That's exactly why I said we haven't gotten to that point.
Yes, that's why we haven't got to that
point. So listeners, please bear with us, okay? There's a reason why we've structured this way, because then you probably understand, and then the answers will drop as well. But I can understand your need to have immediate, right? WhatsApp is immediate, but we also have to build a logical flow so that you get the best benefit of Dr. McCarthy, as I've yanked him into the studio for 2 hours. So yes, he's answered that, right? And it will depend on the type of hysterectomy you have. Not so?
Exactly.
Okay.
Exactly.
All right. We haven't even gotten to types of hysterectomy or what hysterectomy is, but you guys have brought us all those big words. Myomectomy has dropped, hysterectomy has dropped, and let's see what else drops. This is from the day in Maryland has arrived. Is there a significant or thorough study why it is more predominant in Black or African American women? I've heard some people use fibroids and endometriosis interchangeably. Is it one and the same? They are not, but my doctor will answer that.
But this is a very interesting question. Why is it more predominant in Black women? And this points to the genetic nature of this disease. That this is has a genetic root.
Okay.
And as I said, the root cause is something that happens inside the cell. So all the things we are doing after the change are just to modulate its growth, but something has happened inside the cell.
Okay.
Then that is genetic, and genetically we have the gene changes for that more.
Okay.
And that is why it occurs in us. And then she mentioned endometriosis, which I think we should quickly answer. We are not talking about the same thing.
I know.
Fibroids is what we're talking about today. Endometriosis is a different disease, completely different disease, and I think we've spoken about it.
We've done that, and we've done a full series on that, but where the uterine tissue now migrates and is growing in other parts of the body, right? And
they give similar symptoms.
Right.
You see, that's why maybe she's talking about that.
Right.
They give similar symptoms. There may be pain associated with fertility issues and so on. And so they look similar, but they are not the same.
Okay.
And I think she needs to see her doctor to distinguish what she really has. But sometimes they even occur together.
That's what I was going to say.
Double trouble.
Right. Double trouble or double track there. Good afternoon, Norte by Nature. Please thank Dr. McCarthy for me. I nearly lost my mom about 16 years ago, but God used him to revive her back to life from an ectopic pregnancy.
Thanks be to God.
This is from Awo, I think. The name, Awo says, I should thank you. So thank you, Dr. McCarthy.
Thanks be to God.
16 years ago.
16 years ago, okay.
In the business, I was thinking when you mentioned a family where some are fair, some are dark-skinned, and you'd seen all of them, and I was going to say, wow, gynecologists see stuff across generations.
The generational thing is actually very interesting.
Wow.
And it's interesting to see. I treat some of my dad's babies that were born, that he delivered, and now they are coming pregnant, and they are delivering as well. And that's quite interesting.
Wow, okay. Right. This is Peter and McCarthy Hill. Peter, Meshu, what discussion is going on in the studio this afternoon with Mr. Norte? This is from Peter. Peter, we're talking about fibroids, the full 360, and I've got Dr. Michael McCarthy in the studio. Thanks for being so loyal to us, right, Pete? Let's see. I'm trying to get back on track because we have to talk about signs and symptoms as well.
Let's talk about that.
Right. Okay. Just a second. Let me just quickly try and... good afternoon, Norte. Can you detect a fibroid by having a pap smear? Henrietta Mante wants to know. Can you just quickly...
That's an interesting question. There are some fibroids that are actually attached to the cervix.
Okay.
Or coming out of the cervix. And by doing a pap smear, one usually sees the outer surface of the cervix.
Okay.
And so if there's a fibroid located at that point, yes, when you're doing that test, you probably see that there is at least a
based
growth
on the location of the fibroid.
Based on the location.
Right.
But a pap smear is not a diagnostic test for fibroids.
Great. Okay.
The diagnostic test for fibroids is an ultrasound scan.
Okay.
Generally.
Great.
So not pap smear diagnosing uterine fibroids.
Okay. 42 minutes past the hour of 2. On that note, I am going to be maybe declare myself like the speaker and say order. We need to talk about symptoms, right? And then maybe even different locations of the fibroids, right? So that we all get an understanding. If you just tuned in, this is Ultimate Health on Joy 99.7 FM. My name is Norte by Nature. I'm wearing a white shirt. Yep. And I'm in the studio with another white-shirted doctor or gynecologist in the person of Dr. Michael McCarthy. We're talking about fibroids. Yes, two men talking about women's issues. If you don't like it, we'll still talk.
Continue listening.
Yeah, continue listening and you like it. Right. So let's look at signs and symptoms, or should we do the locations?
Let's talk about the different types or locations.
Types of locations of the fibroid. Okay.
Let's put that all together to make everything simple. Let's not complicate matters.
So still send your WhatsApp 0244340437. I will definitely read them. We're going to 4 o'clock today. Okay, so I'll definitely read them, but let me get some space within the uterus for Dr. McCarthy to now lay down some of the fundamentals about types based on location and other things, and then we can look at signs and symptoms. What will you experience that might be a telltale sign that you have a fibroid? Doc.
Right. So most fibroids are either within the uterus or attached to the uterus.
Okay.
There may be a few fibroids that are attached to some other structure in the body.
Okay.
They may be attached to a mentum, a part of the body. They may be on the sides of the uterus, not attached to the uterus and so on. But those are minor in number or in proportion.
The majority of them will be within the uterus
Within
itself.
or attached to the uterus.
Or attached to the uterus.
Yes, those are the majority.
Okay.
And within that group, we can talk about those that are within the cervix.
Okay.
That's the outer, the mouth or the opening of the womb, and those that are in the main body of the uterus. Most of them are in the main body.
Okay.
All right.
Right.
So let's describe first those that are in the main body.
Okay.
Then we'll be describing most fibroids.
Okay.
So in the main body, you have the part of the uterus that is very close to where the menstrual blood comes from. And we call that area the endometrium.
Right. Okay.
And then we have the part which is on the outside of the uterus, which is like on the surface, on the outer surface of the uterus.
Mm-hmm.
And then we have the part in between.
Okay.
So very simply put, those three areas, the part very close to where the menstrual blood comes from, which is the endometrium.
Okay.
And then we have the part which is on the outer surface or the outside of the uterus but attached to the uterus. And then we have the space in between.
Okay.
So the part close to the uterus, if the fibroid is there, if it's close to the endometrium, we call that a submucous fibroid.
Okay.
Okay. 15% of fibroids are submucous fibroids.
Okay.
Then we have those that are on the outer surface, which are not as common. That's probably maybe 10 or again maybe 10 to 15%.
Okay.
These are on the outer surface. They are called subserous.
Right.
Okay, because the outside part of the uterus is the serosa.
The serosa.
And
right.
so we call that subserous fibroid. They may be bulging out of the surface, or they may be attached only by a stalk.
Okay.
Or a neck.
Mm-hmm.
Maybe that's a better word to use.
There's another
Just by
long
a
word
neck.
for that one. Eh?
Yes, so those are the pedunculated fibroids. If they are by a neck or a stalk or a branch or an arm or whatever you want to call it.
Okay.
And then the subserous ones are those that are maybe just bulging out.
Okay.
And then those in between are the intramural or in the wall.
Okay.
Intramural. Mural means wall.
The muscle or the
muscle
uterus.
in the wall of the uterus.
Okay.
So that's the majority of fibroids. 60-70% of fibroids will be within that.
Would this variation in location or type reflect when we start talking about the kind of problems or symptoms you may see?
Exactly. That's one of the reasons why they are classified that way. Yes, they are physically in those positions, but they also give slightly different or very different symptoms in some cases.
Okay.
But we need to remember that fibroids change and they grow.
Okay.
And so today something is just intramural. As it grows and is growing towards the inside, it may become submucous.
Okay.
Okay. So it's growing bigger, and so it's growing towards the inside layer.
Okay.
Or if it's growing towards the outside, something can be mainly intramural, but after a number of years, it is more subserous, tending towards the outside.
And you could have several
and you
different
can have
types
several different types
in one person.
In different locations.
Right.
And all these three types may be in one person.
Okay.
Okay. But we need to understand that this is a dynamic thing. It's a growing thing. They become bigger and bigger. So when they are small, maybe they're just intramural and so on. And then as they grow bigger, then they tend to assume other positions as well.
Okay, great.
This is important.
Right, this is very important. It grows, it doesn't stay the same, and therefore, this is something I always emphasize on this program. You most definitely have to see a qualified professional when you're starting to, experience some of the symptoms we'll be coming across, okay? These are not things you play games with or listen to your friend or your roommate or your church member. It needs to be properly assessed and diagnosed, and then the right intervention would be undertaken. This is very, very, very important. There are different types. They will grow, and you can have multiple types in the same person. So your problem, even if your symptoms are the same, the cause may be different. So let's please understand that. I will come back to the WhatsApp console in a sec. So, Doc, we've got different types and different locations, and therefore different clinical or symptomatic implications. What are the signs and symptoms? Again, let me just throw some of these things out there. I read some things about lower pelvic or back pain, bleeding, difficulties in intercourse. Are these all related to fibroids?
Yes, so fibroids can give a lot of different symptoms.
Okay.
Before I give you some of the symptoms, we should understand that the commonest symptom of uterine fibroids is no symptom.
I like that.
Yes.
Hit it again.
This is just for us to understand. It's for us to get the concept that the commonest symptom of fibroids is no symptom.
So you will not feel, detect, experience anything at all?
Nothing. You won't be feeling anything.
Right.
In medicine, we'll call that asymptomatic. There are no symptoms.
Right.
So you have the fibroids, they are growing in there over the years, and you don't even know that they are growing. Okay. No symptoms at all, 50% of the time.
Wow.
So that is the commonest.
But it's there.
Probably even more than 50%. You know, it's there.
Okay.
maybe small, maybe even large, but maybe in a position that is not really causing much of a problem and so on. And so she's very comfortable and goes about normally. So that's the commonest thing. So we tend to diagnose them when we do an ultrasound scan. Maybe she's coming for a different problem. And then you do an ultrasound scan and you find fibroids. Or like the other lady who said they were diagnosed during her pregnancy. There are a lot of ultrasound scans done during pregnancy. So you do an ultrasound scan and you find pregnancy and you find some fibroids as well.
There's something there.
Yes, and that's a lot of women find out that they have fibroids the first time when they are doing an early pregnancy scan. And they may not even be consequential. They may be small and they may not even cause any problems.
So you may be told it's not a problem.
Exactly.
At that material point in time.
At that point in time. It doesn't mean that they will never become a problem. They may grow and then can cause some problems later on. So that's the commonest symptom. The commonest symptom is no symptom.
No symptom. All right.
But medically, we say most of the time they are asymptomatic or no symptom.
Understood.
Then the other symptoms, let's take them in location. When they are in a situation like the submucous one we described, close to where the menstrual blood will come from, then they cause increased uterine bleeding, abnormal uterine bleeding because of increased surface area, different hormones being generated, chemicals generated around, and therefore you tend to bleed more.
Would this be bleeding during your menses or in between? Increased bleeding, yes, understood, very well. But is it occurring during your normal flow or is it a deviation from your normal flow?
This is a very good question. So most of the time it's increased flow during the normal menses. But they may also have not just increased flow, but increased duration of flow.
So the number of days.
Yes, so maybe she was having just 5 days or 4 days of normal flow, but now it has increased, become heavier. Now it's 7 to 10 days. So
you know why I'm looking at you like that, right? Because normally as soon as we get into flow, the questions will change.
Then the questions start changing and then we are in trouble.
We will do
Let's move from there very quickly.
Another time, please. But increase in the actual volume of the flow and then the duration, number of days.
May also increase, yes. And then there may be bleeding at abnormal times during cycle. Where she just bleeds for a short time. We call that spotting, just a little bit of blood coming out. And that may be also abnormal bleeding. So this is a very common thing. There may also be increase in pain during menstruation with this type of fibroid. The uterine fibroids may also cause pain if they are large and they are undergoing some changes that are painful. And so you may notice pain. Just pain may not be related to the menstruation at all, but pain in the pelvis, pelvic pain. You also mentioned back pain and so on. So they may just cause pain, especially if they are bigger. They could be on the outside, they could be on the intramural section, subserous, or anywhere they can cause pain. During menstruation, it's the mucosal ones that usually cause the pain, but intramural ones can also cause pain.
So if you're having painful periods, it could be related,
especially if you're having maybe painful periods right at the beginning, and then you had fine, no pain, everything was going well, and then you get to 28, 30, 35, and now you start having pain. Then we may be talking about uterine fibroids. The fibroids could cause pain at that time. They could cause pain also during getting close to menopause when they are degenerating and shrinking. They could also cause pain during pregnancy. So pain, excessive bleeding and pain are the two cardinal issues. Sometimes they are also located close to the urinary bladder. We didn't talk about those in the cervix, but those in the cervix are very close to the bladder. And they can press on the bladder. Of course, other ones can also press on the bladder. And so you have symptoms of frequent urination, not emptying your bladder properly when you pass urine and so on. So pressure on the bladder.
So you feel that pressure down there.
That pressure
as if you've got to go. You've got to pee.
And then the next big thing is just the effect of mass. So if this fibroid mass could be just a single one, or it could be multiple fibers that have created a mass together as big as a melon, diameter of 10 to 15, 20 centimeters. Now this mass is sitting in the pelvis. It's going to start causing problems with pressure on the bladder, pressure on the rectum,
So externally, you probably see that the abdomen is...
You will see the mass.
Right.
The abdomen starts getting bigger and so on.
And you're not pregnant.
And you're not pregnant.
Okay.
So just the effect of mass, discomfort, you turn and the fibroid also moves. And so you feel something moving in your abdomen. You touch your abdomen, you feel something there.
So you'd actually feel... You'd actually feel bloated?
No, you feel an actual mass.
It's a mass.
It's a mass.
So when
there are two things
touch,
actually. There are two things.
Great.
One, you feel a fullness or a congestion in the pelvis.
Okay.
Or you could also feel a mass, an actual mass, and when you touch it, you actually feel that mass.
Okay.
Or you can feel that mass moving around.
It moves about.
You turn. It doesn't move about. As you turn position,
it
falls.
It shifts. It has to. Yeah.
Shifts. That's the way.
Right.
You turn the other way, it shifts. So okay, it's moving about. I mean, if you are feeling it, you say it's moving.
Okay.
So let's say it's moving, but it's not really moving. It's the position that you're going through.
I just know. Right.
These things may not be the biggest problems. The biggest problems of mass are two life-threatening problems. The first is that it can block the venous blood that is coming from the legs and therefore predispose a woman to getting blood clots in the legs.
Right.
And these blood clots can travel to the lungs and cause death.
Right.
So this is deep vein thrombosis. And we've had a number of patients who have this. And this is life-threatening.
Okay.
And so this needs to be diagnosed and treated as soon as possible to avoid that life-threatening complication. The second life-threatening complication is where the mass blocks the drainage of urine from the kidney. So the tube that comes from the kidney passes very close to the uterus.
Okay.
And when the mass is big enough to fill out the pelvis and touches the side bone of the pelvis, it also blocks this tube which is running along that same place.
So now we're heading towards renal problems, kidney problems.
Kidney problems, where now you're obstructing the drainage of the kidney and the kidney starts enlarging and then the function of the kidney is compromised and you can destroy the kidney.
And the antecedent or the cause of this is the fibroid.
The mass of the fibroid, yes.
That it's
the
blocking.
mass, because of how big it is and its physical presence, it's macho, if you want to say.
Right.
Let
me just remind folks, it's 2:57, Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. I'm discussing fibroids, the full 360. And you can probably say the full Monty, right? With Dr. Michael McCarthy, a consultant obstetrician gynecologist with the Sinel Specialist Hospital, or Sinel, as somebody called me and said, the guy from Sinel Specialist Hospital in Tema. We're taking our time to break down fibroids, understand them, the different types, the different complications, and then we'll get to the management. Thankfully, we're going all the way to 4 today, so we'll get to do that. And the build-up of WhatsApp questions, right? They are direct, specific questions. People love to have on-air consultation. I guess they don't want to come to Tema or any other facility, but this does not substitute seeing your doctor or your specialist. Okay, so we'll do our best to cover all the questions that I see on my WhatsApp console. We're also live on Facebook and YouTube. Ultimate Health on Joy 99.7 FM. We're talking about fibroids. We've just been looking at the broad range of symptoms, and indeed we've also tiptoed into complications, courtesy of the tutelage we're getting from Dr. McCarthy. Keep sending in your questions, your experiences, and of course, indeed, even if your fears, right? Because that could also be a barrier.
That's a big issue. That's a big issue there.
People's fears, right?
Yeah, what they think about fibroids. I used to think about fibroids before I got into medicine as something quite monstrous. The name alone sounds a little bit odd. Fibroids.
Yeah.
I mean, why did they name them that?
Right.
You know, they named them like that because histologically or under the microscope, you know, the fibrous tissue, there's a lot of fibrous tissue around the muscle tissue.
Okay.
And then they also feel quite firm when you touch them. That's why they're called fibroids.
Okay.
But I had a different thinking that this was this spider-like, spider web-like thing growing, you know. And so I can understand that a lot of people are thinking of all sorts of things that you cannot imagine
happening inside.
Right. But when you see these fibroids, they look very unassuming, actually.
Right.
You know, they look really, they're roundish or oval shaped, very well distinguished from the rest of the uterus, you know. And so when we remove them, we know whether we've removed the entire fibroid or you've not removed them. You know? And quite interesting. So the misconception, the thinking and the fear, I think is something that we'll send them to you, the psychologist.
Real. Send them to me, no problem. There's a whole department of psychiatry, lots of psychologists now, more growing in numbers across the country. But interestingly also, I hear fibroids being mentioned in church. And people are before pastors, in quotes, and all sorts of things are being said about whether it's a fake pregnancy, she's been like this for how many months, no baby is coming, this. And, you know, all sorts of ultrasound, should I say, results are being presented before pastors, right? Maybe my guest will say something about that. But we're doing the, you know, straightforward scientific, medical, clinical facts here, right? I always say knowledge above noise. That's what we're doing here. But I would probably understand why somebody would present with this in a church, right? A couple of weeks back, I did health and religion with Dr. Fred Digby. It was a very interesting discussion. But these things are being presented and the ultrasounds and things are coming up. It is 3 o'clock on Joy 99.7 FM. Ultimate Health continues for another hour, and we're getting deeper into the subject of fibroids. But before I go to direct my attention to the flow on my WhatsApp, let me ask you this, Doc. We've brought in the issue of imaging or ultrasound. How is a fibroid, or how are fibroids properly, conclusively diagnosed?
Yeah, I think this is very important. You just mentioned that people were carrying out ultrasound images and so on. I mean, there are a lot of people doing ultrasounds now that are not qualified to do ultrasounds.
Okay, so the imaging must be done properly by qualified facilities and personnel.
There are people who have learned ultrasound, and the course has taken an additional 5 to 7 years after their medical education.
Okay.
And these are specialist radiologists.
Okay.
And that is what they have learned to do ultrasounds properly and correctly. And so it's not as simple as just doing a 2-week course and then one knows everything about ultrasound. And sometimes you see these ultrasound reports and they are rather misleading, you know, and quite frightening. I'm not saying we can see everything all the time, but one must not just rely on a test. You have to listen to the client, understand what the symptoms are. You need to do a physical examination to see what is really there physically. And then you can use your imaging studies like an ultrasound or an MRI to add to this whole picture and then be able to come to a conclusion and then decide on a treatment plan. It's not just about an ultrasound scan. Oh, I've gone to do scan, macro scan, and then that's it. That's not it. You know, you need to really get well into it. But a properly done ultrasound scan, it could be a transabdominal ultrasound scan, it could be a transvaginal ultrasound scan. Has a very good detection rate of uterine fibroids. Because you can actually see them in the uterus, especially with a transvaginal scan, if the uterus is not all that large. If the uterus is much larger than in the abdomen, then a transabdominal scan, or a combination of these two, will actually see in detail where the fibroids are located. Are they really the cause of the symptoms the person is complaining about? Sometimes the fibroids are not the cause of the person's problem. Though the fibroids may be present.
So sometimes in investigation of a problem, they may be discovered almost as a collateral issue.
Could be.
Right.
Or we could find something different. For example, the client I had who, yes, fibroids, it's this and that and that. And then we do a more detailed exam. There's an exam called Saline Infusion Sonogram, where you actually put some fluid into the uterus so that you can see more clearly with the transvaginal scan. And then you see a fibroid locating at a position that we didn't think it was. And then that gave us the diagnosis that was the issue. So
imaging is very central to diagnosing and pinpointing
very important. Sometimes we even need to do MRIs, magnetic resonance imaging, to locate where this mass really is. Is it an ovary? Is it a uterine mass? Is it adenomyosis? Is it fibroids? And you need to be really sure what it is. Otherwise, you start a surgery And then you realize that you are dealing with something different.
Something totally different.
Yes, and so an MRI not frequently, but I occasionally request for MRI scans when we are not 100% certain what we are dealing with, what the locations are. And a lot of times you find that it's a mixture of two different diseases that you need to be able to manage. And also in counseling the client for her to understand what the problem is. You know, so that they don't come back and say, well, we don't even know what happened, but I had some treatment. You know, but to give that. So the imaging studies are very important, but they must be put in context
of the clinical presentation.
And what is going on and the expected outcome at the end of the day. You know, so that we can get to a conclusion of that.
Yes. Great stuff. Let me try and do a bit more imaging on my WhatsApp console. Keep sending them 0244-340-437. This is Ultimate Health on Joy 99.7 FM with me, Norte by Nature. I'm in the studio with Dr. Michael McCarthy of the Sinal Specialist Hospital. We're talking about fibroids, and we're getting very, very, very detailed. Yep. Hi, I'm 43 years old and I have not been seeing my menstrual period for 5 years now. Can it be fibroid? Well, based on what we discussed in the studio,
You see, the symptom of not having periods is not usually from fibroids.
Okay.
So the symptoms that fibroids are given are usually more days of menstrual flow or higher volume and so on.
Okay.
But you're not having periods
for 5 years.
It's not a symptom, generally a symptom of uterine fibroids.
Okay.
So we need to look at her situation, 43 years, no menses, with another look.
Okay, great. Another one, hey, I want to make a quick inquiry. Adam Naite mentioned on Home Affairs that a lady served him breakfast on the show. All right, I'll let my producer have a look at that later. I don't have a clue. Sorry. Good afternoon, doctor. Please, I started menstruation at the age of 17 years, which I experienced for the first 5 months. Since then, it stopped. After 4 years, all tests were conducted on me, but the doctor detected only typhoid in me, but it started flowing again with some pain and acne in the abdomen. No, aches, I guess, in the abdomen and joints up till now, which I was admitted at the hospital several times for. Some people tell me it's fibroid. Others say if I give birth, it will stop. But I don't know. I want to know my problem. Please, doctor, help me. Well, we don't have a name, right? We just have a little history. I will suggest you see a doctor. But anything you want to say on that?
No, she definitely needs to see a gynecologist because she's not had menses for... did she say 4 years?
Yeah.
And she started at 17 and then had a few menses, and then for a number of years the menstruation stopped. She definitely needs to see a gynecologist urgently.
Right. Okay. Do that for us, please, and give us feedback if there's feedback. This one says, I had an oophorectomy done with both eggs removed. It should be both ovaries, right? Eggs removed, let me see, and half partially left in the left tube, and advised to give birth early by the doctor. Your comments on that?
I don't know what her question is. Yes, she's made her statement very clearly, and I think she should follow her doctor's advice. We don't know exactly what's happening, but yes, it sounds as if part of her ovaries, probably one, and then a part of the other one was removed.
Right.
And for one reason, we don't know why.
Which is the oophorectomy.
We don't know why. We don't know her age. Was it because of cancer? Was it because of endometriosis?
Okay.
Or ectopic? We are not sure.
Okay.
But she definitely should see her doctor and follow that advice. Yes.
Okay. Right. I can't read this one. It's a picture. I guess it has something to do with Palm Sunday. Right. This one says, "Hi, doc. I was diagnosed with fibroid during my pregnancy. I took 3 different scans, and only the first scan captured the fibroid, but the remaining 2 scans did not. So I'm confused. My doctor later told me there is no fibroid."
This is interesting. This we see.
Can this be possible?
Yeah. This we see commonly, where an early scan is done, and then somebody reports that there is a mass.
Okay.
Commonest mass is fibroid, so this must be fibroid. Early on in the pregnancy, sometimes the uterine muscle contracts.
Okay.
And a uterine contraction looks like a fibroid in early pregnancy.
Okay.
Either an ultrasound scan or an MRI scan. And so you need to be a bit careful to make that diagnosis and get the real features of the fibroid, and then correlate it to what is happening before you make that diagnosis. Okay. It is the doctors who should make a diagnosis. The technician doing the ultrasound scan should not make a diagnosis. He should tell us what the features of what he's seeing is, what he thinks it is.
Okay.
But the doctor should make the diagnosis.
Interpretation and the diagnosis.
Exactly, because otherwise you get this situation where something was seen. I don't doubt that something was seen. Something was seen. And the interpretation was that this is a fibroid. So the woman gets to know that, okay, this is a fibroid. Okay. And then later on, two other scans are done. Fibroids are not found. Okay. So we need to weigh carefully the findings that we have. Okay. So here is, again, the imaging. We need to be careful. But the other thing is that if you have a small fibroid, right, you may see it on an early scan because the uterus is also small. Okay. When you now have a gravid uterus of 30 weeks or 35 weeks, and you are trying to look for a 2 centimeter fibroid, you may never find it. Okay. So for this woman, what I would recommend is that 6 weeks after delivery, she should have a very good transvaginal ultrasound scan. Okay. And that will really tell us whether she has fibroids or not. Great.
I'm always glad when I'm validated in my choice of resource person. Dr. Michael McCarthy is with the Sinel Specialist Hospital. Nice answer, straight to the point there. Please, I'm back again. Recently, I had an ultrasound, but I was told my fibroids were as small as my eyes. So he advised, since it's small, he can't have surgery, or he won't do surgery on me. If I deliver again, then he will remove the fibroids. Doc, frankly speaking, I won't give birth again. Please, what can be done? This is from Brimpoma. She's 37. So her doctor thinks, well, have another child, or if you have another child. She says she's done. So shouldn't this be a discussion with her doctor?
No, I mean, this brings us to what is the commonest treatment for fibroids? The commonest treatment for fibroids is to wait and observe. Okay. That's the commonest treatment. Because like in this lady's situation, you have a situation where these fibroids do not seem to be a problem for her. Okay. She's not complaining of any symptoms. Is she the one who complained of pain? Okay, she's the one complaining of pain. So we have to determine whether
she did the IUD.
Yeah, we have to determine whether the pain is from the IUD or the fibroids. If it's from the IUD and not from the fibroids, that means she probably doesn't have symptoms from the fibroids, and the fibroids are small. Okay. And she's 37. I'll just wait. Okay. Observe her over the time.
She has 3 children. She's 37.
Do an ultrasound scan every 6 months.
She says she's done.
Yes, and allow her to carry out her plan. Right. And wait. There's probably no need for surgery.
No need for the surgery.
Probably no need for treatment unless she comes up with other symptoms and so on. Okay. And then that can be done. So fibroids are treated for what they are causing. Right. And not just because they are there.
Not just because you're trigger happy or you've got a patient and you're making some money.
You create more problems.
All right. Okay. So I hope that sorts you out. You can send your 0244 340 437 Ultimate Health on Joy 99.7 FM. We're talking fibroids, the full 360. What have I done now? Oops. Abeku. I've gone and switched on the camera. Hold on. Okay, I'm back. Right, me and my IT competence. Right, good afternoon, Naughty, and your guests. Good discussion there. I had a fibroid operation 10 years ago, and my womb is intact. I have been experiencing my monthly flow, which is normal for 5 days, and I don't feel any pains. But a year ago, I was told I have fibroids. I don't want to have surgery again. Please advise me. This is from Clarissa.
This is interesting. We don't know her age, but I calculate her age to be somewhere between 35 and 45. Okay. And if she has fibroids without any symptoms, she says her menstrual flow is normal. And she does not feel any pain. I would say that she should just wait. Okay. She'll probably get to menopause without any further interventions necessary. Okay. But then again, I mean, we need to look at this case carefully. But from what she has told us, she probably does not need any surgical intervention unless there are other things she hasn't told us about. So, yeah. Right.
Can a fibroid increase varicose veins? Cause a frequent increase of varicose veins?
Well, I don't know which varicose veins she's talking about. Maybe varicose veins of the leg, because those are the most common. The fibroids can obstruct the blood flow coming back from the legs and increase pressure in the veins. Okay. And that can cause reduced flow of the blood, and so can cause thrombosis in the deep veins, and theoretically also cause varicose veins. But then the fibroid mass must be big enough to block the blood vessels.
Okay.
To cause this.
Right. This one says, my lady has been seeing her menses 3 times this month, and it flows 3 to 4 days, being normal for her. What could be the problem? This is the first time experiencing this. This is from Jack in OCM. So he's saying that she's had her menses 3 times after every 6 or 7 days. Could it be related to fibroids?
I don't know. This seems to be something that's happening only this month.
Yeah.
Maybe they should check for pregnancy-related complications, which may be more likely from what he's describing. But yes, fibroids can cause irregular bleeding.
Okay.
But he just mentioned it in 1 month.
Right.
So I would say they should check with the doctor.
Check with the doctor. Yeah. Okay. Jack or JAK in OCM, thanks for sharing that. You can share yours 0244 340 437. This is Ultimate Health on Joy 99.7 FM. AC sends this. Are there alternative medications aside from surgery? Yes, we're going to go into management a bit. We haven't really touched them aside from answering direct questions, so we'll get that. Surgery was recommended for me, but I got scared, so decided not to do it. Can birth control pills control the growth? We'll get to that as well. In the past, it was prescribed for me, so I took them, but I have gained a lot of weight as a result of the birth control pills. I think it was called Provera. This is from AC.
You see, the decision to do surgery is a very important decision.
Okay.
Because surgery is an invasive procedure.
Okay.
And there can be some complications, side effects, and so on.
Okay.
So surgery will only be done if there is a clear benefit to surgery. For example, she's bleeding a lot and her blood level is going down, or she's getting frequent miscarriages, or severe pain, or the mass is growing large.
Okay.
So if those reasons are present and surgery is recommended, then one should take that recommendation seriously. There's nothing wrong with getting a second, a third, and a fourth opinion.
Okay.
But there's everything wrong with being told you need to have surgery and then you disappear.
Okay.
And then you don't have surgery. You know, just because
while something could be going on.
Yeah, just because you are scared.
Right.
No, if you are not satisfied, seek help. See somebody else.
Okay.
Talk to a counselor. Talk to a friend. Talk to somebody who can, help to answer your questions and address your concerns. Okay. But
don't sit there doing nothing.
Just saying that no, I'm scared, I won't have it is not the solution.
Okay.
Unless one is not convinced that the surgery is really necessary, then of course. I
guess this can be very, very, very anxiety provoking and confusing for a woman.
Very,
right?
Very. It's not
and indeed
easy
for her partner as well. I'm going to take a couple of commercials, and when I come back, there are 2 other things I wanted to talk about that could be related to fibroids, painful intercourse, and of course the, should I say, interference or compromised reproductive functioning or fertility issues, right? And then we'll get into the nitty-gritty of some of the solutions or the treatments and management. This is Ultimate Health on Joy 99.7 FM. Stick and stay. I'll be back in a mo.
A hot time needs a hot meal, and a hot meal needs a sizzling hot offer. That's why KFC is offering the hottest deal so far this year with 5 chicken pieces and 5 lime and chili hot wings for only 35 cedis this and every Tuesday. That's almost 50% off. Sink your teeth into golden brown, crunchy, juicy, and out of this world delicious chicken with a hot deal from KFC. See you next Tuesday. KFC, it's finger licking good. Terms and conditions apply.
Hi, my name is Lexus Bill, host of Drive Time on Joy. It's that time again for us to show love to our underprivileged brothers and sisters on the streets. Your superstation, Joy 99.7 FM, presents the annual Joy Easter Soup Kitchen. This year, we warmly invite you to join us feed, counsel, entertain, and provide medical aid to the less privileged in our society. We invite you to donate charitably towards the Joy FM Easter Soup Kitchen. You can do this in cash or in kind at the front desk of Joy FM Kokomlimle. There's so much we can give. Bags of rice, bottles of cooking oil, soft drinks, cartons of chicken and fish, flour, pharmaceutical products, and many others. Call us on 0302-216-540 or 0244-663-968. The Easter Soup Kitchen is powered by your superstation, Joy 99.7 FM, and supported by you, our loyal listeners.
Ojame Kwame and Joy Prime present the Made in Ghana album launch concert at the Plus 233 Jazz Bar and Grill on Saturday, the 20th of April. Doors open 9 p.m. sharp. Tickets going for 100 Ghana cedis. Available at Koala branches in Airport and Osu, as well as JoyFM, or call 020-951-5510. The Made in Ghana album has features from Wiyala, King Ralph, Atongo Zimba, Abiana, Fancy Gadam, Fali Finest, Ifriye Wuta, Kwame Eugene, Kitty, Curl Songs, Ayisem, Belly Nuna, Yaya, Naomi Anoko of Wulome, and Kwampa. The Made in Ghana album launch concert is sponsored by Hits FM, Grand Casamora, Niche Chocolate, and Ahead Media. More information, call 020-951-5510. Brought to you by OK Music and Joy Prime. Pre-order the album on aftown.com.
For 3 days only, it's Wacky Weekend at ShopRite, and that means bigger deals and the craziest prices. Get Lipton Tea Bag 25s for a crazy 3 Ghana cedis, 49 pesos. And the 415-gram can of Heinz Baked Beans at a ridiculously low 5 Ghana cedis, 89 pesos. Don't miss ShopRite's Wacky Weekend from 12th to 14th April, only at ShopRite. Lower prices you can trust, always.
Joy 99.7 FM.
You're welcome back to Ultimate Health on Joy 99.7 FM with me, Naughty by Nature. I'm in the studio with Dr. Michael McCarthy of the Sinal Specialist Hospital. He's a consultant obstetrician and gynecologist. And we've been doing the fundamentals of fibroids, the full 360, and we're not done. We're going all the way up to 4 p.m., after which we'll hand over to the sports guys. And we've got loads of questions. We'll try to answer them, and then we'll go into the management of fibroids, the treatment, and the different options, right? Hopefully we can do the full Monty all the way up to possible hysterectomy and what that is, right? I got this back from the lady who asked whether her menses would stop after taking out her womb. It says, did you say the fibroids would shrink with age? I'm almost 50 and I don't want to have another surgery. This business of shrinking.
Yeah, I think it's fantastic. I mean, she's almost 50. There is the possibility that these fibroids may not be as problematic again as she increases in age. So this is a discussion she needs to have with her gynecologist as to whether the hysterectomy is really necessary or not, depending on what is being experienced.
Okay, right. Dede in Maryland says, what about heavy clots during menses? Are these due to fibroids?
Could be.
Why the heavy clots? Is it that the fibroids are degenerating, Dede?
No, it's just the fact that the presence of the fibroids tends to increase the rate of bleeding during menstruation, and therefore more blood clots.
Okie dokie. Sorts that out for Dede. Hello, Norte. Good afternoon. I was diagnosed with complex ovarian cyst in November last year. The doctor prescribed for me a contraceptive pill. I was so scared. I did not go back to the hospital, and I did not buy the contraceptive pill either because I felt it will impede childbirth in the future. Please, can I visit Sinal for observation and doctor work on weekends? This is from Akosia.
Interesting. To be good to know your age, Akosia. Complex ovarian cyst in an older woman is quite worrisome. If it is in a younger woman, it could be endometriosis, for which a good treatment is a contraceptive pill.
Okay.
But we need 31. So more likely, less likely to be cancer or malignancy, and more likely to be something like endometriosis and so on. One needs to make a diagnosis in this case and decide whether it's endometriosis, whether it's just an ovarian cyst, and so on.
And she needs help with the process as
well. And then the appropriate treatment should be given. I know she's scared. She says, I'm scared to go back to the hospital because of what was prescribed. But sometimes these medications are the correct treatment, and they work very well. But we need to just have it in perspective, and she needs to understand and agree. I would say she should go back to her doctor and talk to her doctor again. Maybe the explanation didn't go down well. Of course, she's always welcome to see me as well if she wants to.
And it's good. Last week we had you with the full team, the midwife and the clinical psychologist at
Yeah, that
Snell.
was very good.
Right.
That was very good.
So maybe some help, multidisciplinary help for her as well along the process.
That will help. Yeah, that will help.
Okay, but you should be able to get this at most facilities as well. Okay, before they say we're just promoting Snell. Right, as the Fibroid Center.
We're promoting health.
We're promoting health.
Yes.
Thank you. I like the way you put it. Hi, Norte. This is Amber again. I started looking old and growing lean, but after the removal, I look like a young girl and, like I said, like a virgin. Whoa. This is Amma, who had 2 surgeries on fibroids. The last one was last year, and she had her womb removed. And she's been getting a bit forgetful and having hot flushes, but her sex life, which seems to be the, major dividend for her. And she says she's like a virgin. Amma.
I think this is good. Positive effects of treatment of fibroids.
Yeah.
Fantastic.
Okay, just don't overdo it though, because you're not a virgin. Maybe some screensaver stuff, but enjoy it whilst it lasts. Okay, good positive stuff there. Great show, Naughty. I've learned a lot today. This is from Campbell in Dakuman. Oh, Campbell. Yes, the lady who can listen to Ultimate Health after delivery. Can you imagine? Campbell, it's been a while. Get in touch. Nice hearing from you. This one says, I had a hysterectomy for the treatment of multiple fibroids, though not big, and endometriosis being complicated with a hematothorax. Ouch.
Yeah, so she's got something more complicated. The question is hysterectomy the only treatment? It is not the only treatment. There are a number of treatments for multiple uterine fibroids. Okay. But she has a complication of endometriosis with blood in her chest. Right. And so that needs to be dealt with also. Right. The cardiothoracic surgeons need to weigh in on this one as well. Okay. So we are talking about something more complicated, right, which is just beyond just the uterus. Yeah. We're having the chest, the lungs also being affected, and which needs to be treated as well.
Good evening. I'm 35 years old and I had my menarche at 12, so I started menstruating at 12. I could bleed heavily with clots and experience dysmenorrhea often. Was never diagnosed of fibroid. It was 16 years later before I was diagnosed of having a fibroid, which they said were very small. My problem is I don't have dysmenorrhea again, but I have Mittelschmerz for about 12 to 15 years now. Is it a result of the fibroid or what? Doc.
Interesting question. Okay, so
did I pronounce that right?
Mittelschmerz.
Mittelschmerz.
It's
German.
A German word.
Right, yeah. Mm-hmm.
You need to speak German.
Okay. Not on Sundays. What does it mean?
35 years and pain in the middle of the cycle.
Okay, Mittelschmerz.
Exactly, which has to do with ovulation, and so some people get this pain during ovulation.
Middle of the cycle.
Mittelschmerz, yes.
Okay, all right.
And that's what she's feeling. Yes, people have that. Maybe she wasn't having it before, but she's having it now. Okay. But she's talking about being 35 years old and with heavy bleeding and pain during menstruation. But that was when she was having her initial cycles. But now, 16 years later, it is noticed that she has a fibroid, and they said they are very small. Now, this just shows you that the fibroids start appearing for most people later on. Right. This one is in mid-30s.
Mid-30s, right.
But the fibroids don't seem to be the cause.
Okay.
It looks as if the fibroids are just diagnosed incidentally, maybe on an ultrasound scan, right? And that may not be the cause. But we don't have enough information. Maybe there are multiple small ones. Sometimes you have small fibroids. Okay. But there are many. Right. Maybe 20 or 30 of them. Okay. So when you add them all up, they give quite a size to the uterus.
Okay.
And
so the clinical presentation and the history is very important.
Yes.
I'm going to be asking you, I'll come back after reading a couple of these, that, who should you be talking to? Right, I'm speaking now to a consultant or an obstetrician gynecologist, okay, OBGYN, right? But who should you be talking to? Should your general practitioner be diagnosing and managing your fibroids? I'll come to Doc for that answer, but let me read a bit more, right? I am 36 years old and I had a myomectomy in 2010. Subsequently, I've had 2 babies between 2014 and 2016 through cesarean. I'm thinking of having a 3rd child. My concern is, what if the fibroid returns again? This is from Linda.
Well, it's interesting that 6 years after her myomectomy, she has been able to give birth. And that is
Twice,
nice.
right.
Yes. First 4 years after, and then 6 years later.
And nothing here shows that the cesarean is due to
Yes.
earlier history.
No, maybe because of the myomectomy.
Okay.
A lot of the time after a myomectomy, we recommend cesarean section, unless it was not as invasive as most of them are.
Right.
And then she's thinking of having a third child. I would say that if nothing else is happening and she's comfortable, she should probably follow her wishes.
Right.
As for the fibroids,
in consultation with her doctor.
Yes, in consultation with her doctor. As for the fibroids, the new ones will start growing. Let me address that problem quickly.
Okay.
About the fibroids recur. They come again.
Right.
You know, the fibroids that we remove never come back.
Okay.
It is always new ones that are growing in the womb that will then appear again. And that is why it takes a number of years before they will start appearing again. This woman was 6 years, and she didn't mention that her fibroids have returned.
Okay.
So all the fibroids that we find during surgery, we remove them.
Okay.
We remove all of them.
Right.
And then if anything will come back, it will be a new fibroid that will grow. As for the old ones we have removed, they are gone.
Okay.
They are gone. They don't
resurrect.
Yes. Okay. So if she hasn't got any problems, I think she should talk to her doctor and then go ahead.
Okay.
If they return, if the new ones grow, well, I'm sure they'll be managed.
All right. I want to hit two things with you, Doc, and then I will announce my phone lines. One, the issue of who you should be seeing. And then two, can you say emphatically, fibroids, as we've discussed and described and defined, are not cancerous?
Fibroids are not cancer.
Right.
I think we need to answer that clearly.
Yes.
They are not cancer. They don't become cancer later on.
Okay.
So having fibroid does not mean that you are going to get cancer or there is cancer or they are going to turn into cancer if you don't remove them and so on and so forth.
Okay.
However,
right.
fibroids in quotes that occur after menopause may not actually be fibroids at all, but they may be a form of uterine cancer.
Okay.
So that's a different thing. So if you are above 50 and you start now having a mass in your uterus, you need to have it evaluated urgently.
Okay.
It may not be a fibroid. It may be a uterine cancer, malignant mass.
Right. Okay.
So the older woman who gets what seems to be a fibroid it may not be a fibroid.
So essentially what we've been talking about and the focus of today's discussion is non-cancerous growths.
Exactly.
Non-cancerous growths.
Exactly.
Okay? All right?
Exactly.
I wanted to hit that one. Now, this business of who you should be seeing. So, well, okay, I did a scan. A doctor or somebody is helping me with this. Who should I be seeing?
Women see midwives. They
Right.
see general doctors.
Okay.
And they also see gynecologists and so on. Fibroids may be diagnosed across the range of health workers that the woman may be seeing.
Okay.
She may even be seeing her hematologist or cardiologist for one reason.
Wow.
And there may be, I've had referrals from the physicians who would say, look, we have a patient with deep vein thrombosis. We think that is due to the fibroid that she's having. So, the women are going to be seen all across board.
Across the chain, right.
When we make the diagnosis, and the fibroids are symptomatic and they require treatment, they should then be referred to the gynecologist.
Okay.
And then we can give very clear treatment plans to the women. I think that one of the most important things about this is to understand what is going on and have a long-term treatment plan in mind.
Okay.
It's not just, sometimes some come to me and say, I've been told I have fibroids. I want to have surgery. And then you go through the whole thing and realize that she does not need surgery at that time. In fact, surgery is not even going to be helpful for her.
Right.
And so we sit down and say, okay, you need to have this, that, and the other, and this is the sequence.
Okay.
You know, so a treatment plan can then be drawn up.
Okay.
And then that can be followed over time.
All right.
So that is how I think that it should be managed.
Great. 33 minutes past the hour of 3 on Joy 99.7 FM. I'm going to activate my phone line 0302-216-541. As I do so, let me underscore that we're now going to go into the management proper of fibroids. Okay, we said we'll do the full 360. Hasn't been that easy because you people have taken us beyond 460, 560. You're going the degrees. We've just gone around like the arms of the clock. But we'll try and do our best. 0302-216-541. Ultimate Health on Joy 99.7 FM. We've been talking fibroids, and they've been growing, so they filled almost the 2 hours. But we can't speak about these enough, and it's a very important topic. Please, my woman has been seeing little clots in her menstruation. What could that be? This is from Isaac in Adenta.
It could be normal. It could be normal.
Okay.
It could be normal.
Okay, Isaac. But she should have it checked out as well if she feels it's a problem.
It could be normal. You can have little black clots in normal menstruation.
Okie dokie. This one addresses me as Ultimate Health CEO. Please, I want to know, is fibroid hereditary or it comes as a result of bad or foreign-like kind of eating among ladies in Africa? This is from Saint Padmore or PDM in Dansoman.
I think it's more hereditary.
Yeah. We mentioned that, the genetics of it earlier on, okay? Thanks for making me a CEO. I hope it comes with money. Hi, I had a hysterectomy and my ovaries are intact. The problem is my sex drive is just gone out of the window. I just don't know what, or I just don't know. I just don't want to know. Hey, okay, she wants to know. Is it normal? Right? Sometimes I have a challenge.
Hysterectomy can have different consequences.
Okay.
One of the important things about a hysterectomy is the psychological impact of such a major surgery.
Okay.
And that's why it's important, even before surgery, to assess the patient's psychological state,
right,
and what she's thinking and what she's going through. And then you can make some inferences of what you think may happen afterwards.
Okay.
If she's really not happy with it, then you know that you may have to do some more work.
Okay. Sex drive.
The sex drive is mainly from the ovaries. Mainly from the ovaries. So once her ovaries are still in, I think that she could see a counselor for this, and there may actually be something significant that can be done for her.
Alrighty. Okay, doctor, my menstrual flow is like 2 days. I've tried every possible means, but nothing is happening. I once consulted a doctor, but was told it is normal. But honestly, I get worried about it. If it can affect my fertility. I'm 30 years old, but haven't given birth. We'll be glad if I can have the doctor's number. Go online and just Google Sinel, and you get everything you need about Sinel, and you probably get a chunk of Dr. McCarthy as well and his team. Ajiman has been on my line for a while. Good afternoon, Ajiman.
Yes, sir. Good afternoon.
Is this Ajiman in Tema?
Yeah, Ajiman, this is from tonight, Tema.
Oh, next week you should join me. We'll co-host, okay?
I'll be glad.
Right, share with us.
Okay. In the doctor's submission, he was saying something like, it sometimes passes through the family line. But I heard it somewhere that it is a natural phenomenon. So people sometimes do say that bad girls don't get fibroids just because when you have intercourse and you have babies at a tender age, fibroid is out, because it has been said that if the womb has been left bare for so many years, then the fibroid sets in. Example, if a lady is above 30, then the fibroid is possibly coming into.
All right, so what's your question?
So, if it should be through family line, and maybe your sister or your siblings were having it, and you stay for a longer period, let's say you don't stay for a longer period, I think you are not going to have it. Secondly, when we talk about surgery, in this part of our world, people normally being afraid of surgery because they term it as 50-50. So, what is the proof that after the surgery, everything will be diminished? Also, some people talk about the herbal issue. I think sometimes people think the herb can help a lot because when you drink, it can shrink it completely.
So your question is about whether herbal treatments are effective. Okay, all right.
I think that the herbal...
Okay, good. I have another caller on the line, Ajiman. Okay, I've got all your questions. Right, I have Mary on my line. Good afternoon, Mary. Thanks for waiting.
Good afternoon.
Right, where are you calling from?
Yes, I'm calling from Kolebu.
Kolebu, share with us, Mary.
Please, I'm having fibroid, but in my early stages when I was in SS, I was bleeding with clot. Let me say 1 week, every month, 1 week. So I became very poor. So I saw a gynecologist at Kolebu, and he gave me a contraceptive. By then, I wasn't having sex. So let me say I grew very fast. But later along the line, I was diagnosed with fibroid. And I'm 35 now. I've not given birth. So my problem is they advise me to give, for me to give birth early so that it will not give me complications later in life.
Are you still on the contraceptives?
No, I've stopped using it.
Okay. So the question again?
The question is it good for you to take contraceptives while you are not having sex? Because I didn't understand why the doctor gave it to me whilst I wasn't having sex, and later I was being diagnosed with fibroid, and I've not given birth yet.
Okay. Right. Okay. Let me take Papa in time. I'm trying to keep all these in mind. Papa, good afternoon. Hello, Papa.
I just want to find out what is the difference between fibroids and then prostate.
Okay. Right. Thank you. Straight to the point. Okay, let's deal with that one first. I think we can do that and dust it. And then difference between fibroid and prostate.
So that's interesting. Maybe we shouldn't complicate the matter.
Yeah.
But the prostate is in the male.
Okay.
And the fibroids and the female. So basically, that's the difference.
Different thing. Right.
But the prostate actually gets some similar condition where you have hyperplasia or excessive growth of the prostate, and then that becomes bigger and so on.
But that's in the men.
So that's in the men, and the fibroids we are talking about is in women. So we're not talking about fibroids in men.
Okay.
We are talking about uterine fibroids in
women. All right. Mary, SHS had problems. Gynecologist put her on contraceptives, managed it. She's having problems and worried about having children.
Yes, contraceptives are not used only for contraception. Sometimes they are used for other things to help solve some other problems with the uterus and with the ovaries and so on. So it's a good practice to use contraceptive pills appropriately for some other conditions.
Okay.
Abnormal uterine bleeding, heavy excessive bleeding, sometimes to address severe menstrual pain, sometimes even for endometriosis and so on, adenomyosis.
Because essentially you're using the hormones to stimulate different things.
Even infertility treatments of polycystic ovary syndrome and IVF cycle regulation, we can use contraceptive pills. So we even use the contraceptive pills to boost people's fertility. Okay.
So Mary, see your doctor. You can use them for different reasons. So that's important. I'll hang on to Ajimon Joseph's 3. Nana is on my line from Tema. Tema is leading today. Nana, thanks for waiting.
Hello, good evening.
Yes, you're welcome.
I'm the one who sent in the message concerning the metal smith.
Okay, the German, the mid-cycle,
So I couldn't get the response very well. Like I said, I'm 35 years now. I have a son, 6 years. I wasn't having fibroid earlier on, but I was having the heavy flow at menarche. So somewhere 27 years before I was diagnosed of having fibroid. But I've been having this painful ovulation for some time now. And I want to know why I keep on having the fibroid. They say, even up to now, they still say it's very small. So then what is causing the painful ovulation?
Ovulation can be painful. Some people earlier on may not have been ovulating, and then for one reason or the other, and now they are ovulating more, and so they are getting more of the symptoms of ovulation.
Right.
So that may be what is happening, that you are now ovulating more regularly and having the symptoms of Mittelschmerz.
Okay.
Yeah, but if the fibroids are small, they are not very likely to be the cause of pain. And if it is cyclical, happening every month, it's more likely to be from the ovulation. I don't know whether we've answered your question.
Right. Okay. She's not on the line now. I have Oti on my line. Okay. So, Oti, good afternoon. Oh, I lost Oti. 0302216541. We're juggling several, should I say, platforms, trying to get you responses to all your questions. Good afternoon. Note. No, let me take the responses. Bad girls and fibroids. If you are sexually active, you have a child or two, you're not likely to have them, according to...
Sexual activity does not cause fibroids, or lack of sexual activity does not cause fibroids.
Okay.
We don't have that relationship. So I know it sounds very exciting to say that, and so people may want to try to link the two up, but that's not the case. But yes, the issue about pregnancy, I mentioned that not having a child puts one at a higher risk of fibroids in terms of incidence. But having a child earlier does not mean that one is protected from having fibroids.
Okay.
And you can clearly see that he was trying to dispute the genetic line, but you can see that it's not a matter of number of pregnancies, but it's a matter of where in the genetic line that you fall.
Right, great. Hi, Note. Good afternoon. I had a full hysterectomy at 45. I was so frightened, but Prof. Lassie was so good at counseling me. It is so... Oh, the rest of it is... I'll read that in a second. I've got Theresa on my line in Accra. Theresa, good afternoon.
Yeah, good afternoon, Note. I had BTL, or I did BTL at age 36. I'm now 40. But after that, anytime I menstruate, I have this pain, abdominal pain. I don't know if it's ovulation pain. I mean, anytime I have my period, 5 days after that I ovulate, I have this pain. I mean, my abdomen due to my vagina and all that. I don't know what exactly it is. I went to see my gynae, he checked and said it's nothing, and gave me some medication, but I still have this pain. I don't know what exactly it is.
Are you taking the medication?
That's right, yes.
You are taking the medication?
I have taken it for 2 weeks. That was last month.
All right.
And this month it happened again. I mean, as I speak to you, I'm going through the pain.
Okay.
And I don't know why. There's nothing there. I haven't been diagnosed for fibroids, so I don't know why.
Okay. So,
yeah.
Post her cycle, then
yes,
when she ovulates, she has pain.
Yes, I think she's describing a situation that she needs help for. I will say that she should immediately go back to her doctor. It's good that the pain is happening now, so she can see the doctor whilst there is pain.
Right.
Sometimes clients come with a complaint, but the complaint is not actual at that time. And when you check, you don't really find anything. It's always good to have it happening at that particular time as well. So if maybe you've seen him once and he's put on some treatment, it's not working, I think the next step is to immediately go back so that he can build on the knowledge that he has about your system.
Okay.
And then maybe do something else. There's usually not one solution to a problem,
right,
but there may be different approaches and things he may do.
Okay.
And I'm sure when you go back a second time, he will look at it again and do something else.
Okay, about 15 minutes to touchdown time. I've got Nanaya hanging on the Spintex Road. Nanaya, good afternoon.
Good afternoon.
Thanks for joining us.
Thank you.
Right, share with us.
Yes, I was diagnosed of fibroid last year when I got pregnant. And then on my way through pregnancy, like 6 months, I lost my baby out of preeclampsia or something like that, because they had to take the baby out. So afterwards, after 3 months, I took an ultrasound scan, which I took to my doctor, and then he explained that there are no fibroids in the uterine fibroids, but found in the walls of the uterine. And so before I took the scan, we're planning on getting rid of the fibroids. That's through the myomectomy.
Yeah.
And then, but after I took the scan, he explained that there are no fibroids found inside the uterine.
Yes, so the location was different.
Yes. And so he said, but they are huge though. But he said that if he can only suggest a surgery for cosmetic reasons. That's if I feel my tummy is too big and want to take it out.
Okay.
But it won't be a problem for
it won't affect the pregnancy, yes. So what's your question, please?
So my question is, can I go on with another pregnancy? Because afterwards, I've been trying to get pregnant. I've not gotten pregnant yet. But I'm asking if it's as a result of the fibroids that it's preventing me from getting pregnant since I started trying again.
Okay. Right. I think you got the gist of that.
Yes.
Right. Let me just take Oti quickly, and then we'll wrap that up on that, because I think she answered the question in the question. But Oti, good afternoon.
Absolutely.
Yes, please share with us quickly.
I know someone has taken 3 fibroid, and the person has not have any child. Can it be possible that can we get pregnant again? You see.
The person has had fibroids removed 3 times.
3 times of fibroid.
And does not have a child. And you want to know if the person can have a child.
again.
Okay.
That's possible.
Understood. Okay.
Yeah, but second one, can the fibroid get into the womb inside so that they can take the womb off, or it just take some space of the womb?
Okay. Right. We've dealt with some of these in our earlier discussion, but we'll come back to that. All right. So the lady who's asking, can she still have children? Her doctor seems to suggest that the location of the fibroid will not interfere or compromise a pregnancy. So he would probably do that afterwards, but she's still concerned.
Yeah, I'm not too clear. What is the question she wants?
Because she said it's not located within, and the doctor has said the location would not affect a pregnancy, right? And so she can go ahead, and then but it's still big, right? Okay. That's what she said. Right. So she's still uncomfortable about pregnancy.
I think her questions have not all been answered yet.
Okay.
And I think the first step is for her to go back to her doctor.
Okay.
With a list of questions. And
because she lost a pregnancy at 6 months as well.
Yes, and really, but not related to fibroids. It was related to preeclampsia.
Yeah.
But so she should go back to her doctor with a list of questions, the things that are really bothering her mind, and ask those questions.
Okay.
The next thing she can do is to get a second opinion from somebody else and find out what that person also thinks. She can get a third and fourth opinion. I think that once her questions are answered, then she should be able to take a decision. The other thing is that if the fibroids are very large, yes, you may be able to get pregnant, but then they tend to create some complications during pregnancy.
All right.
So she needs to be aware of that as well.
Okay, great. I'm going to take a commercial block and then come back and wrap up, okay? We've got lots. We can't take any more calls. We're going to try and wrap up and then take a word or two on some of the interventions. Stick and stay.
Time needs a hot meal, and a hot meal needs a sizzling hot offer. That's why KFC is offering the hottest deal so far this year with 5 chicken pieces and 5 lime and chili hot wings for only 35 cedis this and every Tuesday. That's almost 50% off. Sink your teeth into golden brown, crunchy, juicy, and out of this world delicious chicken with a hot deal from KFC. See you next Tuesday. KFC, it's finger licking good. Terms and conditions apply.
It's coming this June. The 4th Annual Emmy Africa Awards, West Africa's biggest award event, celebrating men who shape Africa. Nominate your Man of the Year. Visit EmmyAfrica.com for information on categories and nominate or send your nominations to nominations@EmmyAfrica.com. Your essay should not be more than 100 words and should include the nominee's profile, the category you're nominating them for, and why. Emmy Africa Awards, celebrating the Men of the Year, inspiring greatness, powered by Carbon AV, EM Magazine, and proudly supported by the Multimedia Group. For enquiries, call 020-201-8870. Emmy Africa Awards.
Salt and Light Music Ministry presents your favorite choir, the Harmonious Chorale, in a concert dubbed Festival of Praise and Worship 3. Theme, Immersed in the Spirit. Date, Easter Monday, 22nd April 2019. Time, 4 p.m. prompt. Venue, Accra International Conference Center. Rate, 50 Ghana cedis. Buy your tickets from Silverbird Accra Mall, Kuala Osu, Airport Shell, Community 8 and 11 Shell, Dansoman Shell, Bachona Total, JoyFM, Salt and Light Ministries office at the Linkbay, or call 0276-389-747 or 0268-130-615. Official media partners, JoyFM, Joy Prime, My Joy Online. This is a not to be missed evening of surprises as we deepen our relationship with God.
Ojame Kwame and Joy Prime present the Made in Ghana album launch concert at the Plus 233 Jazz Bar and Grill on Saturday, the 20th of April. Doors open 9 p.m. sharp. Tickets going for 100 Ghana cedis. Available at Koala branches in Airport and Osu, as well as Joy FM, or call 020-951-5510. The Made in Ghana album has features from Wiyala, King Ralph, Atongo Zimba, Abiana, Fancy Gadam, Fali Finest, Ifri Free Wuta, Kwame Eugene, Kitty, Curl Songs, Ayisem, Belly Nuna, Yaya, Naomi Anoko of Woolome, and Kwampa. The Made in Ghana album launch concert is sponsored by Hits FM, Grand Casamora, Niche Chocolate, and Ahead Media. More information call 020-951-5510. Brought to you by OK Music and Joy Prime. Pre-order the album on aftown.com.
Have you dreamt about completing your MBA at a top university in the United States of America? Are you ready to pursue that desire with just the tuition fees holding you back? Well, dream no more. The MBA scholarship to the University of California, Riverside, USA, covering your tuition fee to the tune of $120,000 is available for grabs only on Drive Time on Joy 99.7 FM. The MBA scholarship competition will be kicking off on the 10th of May as one of 10 eligible contestants vie for the ultimate prize of $120,000 MBA scholarship to the University of California. Requirements: you simply must be gainfully employed and even better in management position. Ensure that your organization will allow you time off work to go study in California for 2 years, and you might just be on your way. For more information and registration, visit www.tkcafrica.com. Registration starts now and closes at midnight on Tuesday, 30th of April 2019. Terms and conditions apply. The MBA scholarship to the University of California, Riverside, USA is proudly brought to you by TKC Africa, the MBA Tour, and University of California, Riverside, and in partnership with your radio for discerning listeners, Joy 99.7 FM. Call TKC Africa on 0548-865133. The MBA Scholarship. Live your MBA dream.
Joy 99.7 FM.
Welcome back to Ultimate Health. We have about 5 minutes. This says, hi, Naughty. Good afternoon. I had a full hysterectomy at 45. I was so frightened, but Prof. Lassie was so good at counseling me. It is so important. Exquisite show with an excellent resource person. This is from Akosia. Many thanks, Akosia, for sharing that. Whoa, just look at this. Wow. The flow on my... Hello, Note. My mom had fibroids 20 years ago. She had a partial hysterectomy at the time. She's 54 years now. She's recently been complaining of lower abdominal pain and spotting. What could be the problem?
That's an important one.
Yeah. Okay. Go ahead.
That's an important one. I think that bleeding after menopause, even if you've had a hysterectomy, you're 54, is very important. This needs to be investigated by the gynecologist.
Okay.
You should see a doctor.
Right. It looks like I'll have to sweep you over to next week for the actual interventions. Good afternoon, Note. I really need the doctor's number. I'm Celestina, 26 years of age. I became pregnant and felt pain at my right side, and the screen says my right ovary has become so large. Please, doc, help, please. Okay. We'll put you in touch with Sinel and see if they can assist you. Abeku, please make a note of that so that I can go back to that. Good afternoon, sir. I had a menopause at 47. Now I'm very dry. I don't even feel for sex anymore as compared to when I was active. This is Na. All right. Thanks for sharing that with us, Na. Good show, somebody says. Whoa, that's a long one. Oh, it's not for us. Okay, it says good show. Thanks. We're here for you, and you make it happen this and every Sunday. This is Dede again. Why is it that once nearing menopause is advised to do a hysterectomy to get rid of fibroids? Why can't it just be normal fibroid removal surgery? That's the normal myomectomy. This is from Dede. I'll get Doc to comment on that quickly.
Yeah, it can be. It can be.
Depends on this.
It can be a myomectomy also when one is getting towards menopause. Only that at that point the definitive treatment of hysterectomy, because one is not planning on having children again after that point. But a myomectomy can also be done if that is what the patient wishes or desires.
Great. We didn't get fully into the interventions, right? We're out of time even when we had 2 hours. And that tells you that...
So maybe we need 6 hours.
There you go. Fibroids grow.
I think they have grown today.
They're threatening to grow into sports. But I have to hand over to sports. And, for my listeners, or to my listeners, you know what? The thing about Sunday for me is that sometimes my resource persons actually come here from church with their families. They wait in the car and so on and so forth. It's not the case for Dr. McCarthy today, right? But it is a stretch, all right? So I'll do some fiddling with him and his team and see if we can go go next week and go into detail on hysterectomy and some of these other interventions, right? So that we get to understand it. And I'm sure we'll probably get also into the flow when it comes to menstrual cycle and all those other things. Doc, what do you say? We'll talk in the car park.
yes. I think it's been a good time, and I'm happy we'll be able to answer many questions. But I think there are more, and we'll see how we can
get into detail, right? If we didn't quite exhaust your issues, it's because it's so detailed, and we have to take our time whilst balancing this whole job of being democratically interactive on WhatsApp, on the phone lines, and everything. Many thanks again, Dr. Michael McCarthy of the Sinel Specialist Hospital. The sports guys are in, and we're ready to go with them. Stick and stay. Many thanks to my producer, Abeku-san Kofi. My name, as always, Naughty by Nature. Happy Palm Sunday. And if you can, wear white like Doc and I are doing. It definitely had an impact on the show. Stick and stay. We'll be back next week.
Joy 99.7 FM.
This afternoon, Liverpool can take a step closer to